Welcome to this introductory video about patient safety as a dimension of quality improvement in healthcare. I'm Dr. Ashlyn Elliott, a health professions educator working with the VA Quality Scholars Program, a national interdisciplinary training program that advances the healthcare improvement skills of doctorally prepared healthcare professionals to become future scholars and leaders in healthcare improvement. In the year 2000, a seminal article titled "To Err is Human" identified that 44 to 98,000 Americans die a year because of medical errors. This marked the beginning of the modern patient safety movement. Shortly after, another influential publication titled "Crossing the Quality Chasm" outlined the 6 dimensions of healthcare quality, including safety, effectiveness, patient-centeredness, timeliness, efficiency, and equity. In this video, we will discuss the definition of patient safety as a dimension of quality, identify the role of human and system error in patient safety, and describe how creating high-reliability organizations can result in quality improvement in patient care. Let's start off by reviewing some definitions surrounding patient safety. The Institute of Medicine defines patient safety as the prevention of harm to patients. Prevention of harm is further described as freedom from accidental or preventable injuries produced by medical care. Another commonly used term when discussing patient safety is adverse events, which is used to describe patient harm that results from medical care. Error is another broad term referenced when discussing patient safety that refers to the act of commission, which means doing something wrong, or omission, which means failing to do the right thing. Over 20 years have passed since the publication of "To Err is Human." However, the rate of preventable harm remains high. Several studies indicate that 10 to 12% of hospital patients experience adverse events, highlighting the need for continued innovation and improvement in healthcare to mitigate the risk of adverse events. Prior to the modern patient safety movement, individual healthcare providers were often blamed for errors, suggesting that errors were due to inadequate knowledge or skills. However, errors are rarely isolated events and instead are usually impacted by flaws in healthcare systems. A systems approach to patient safety is the viewpoint that most errors reflect predictable human failings due to poorly designed systems. Utilizing a systems thinking approach in healthcare has led to improved identification of factors that predispose a system to error. British psychologist James Reason pioneered the systems thinking approach and created the Swiss cheese model to help visualize the role of system flaws and human error. In his model, Reason states that the errors made by individuals result from flawed systems. The flaws in systems can be visualized as the whole scene in Swiss cheese. This imagery highlights the importance of identifying situations or factors that make human error more likely to occur and creating solutions to get rid of the holes in the slices of Swiss cheese, which represent the various layers of a system. It is important to note that this approach does not eliminate the clinician's responsibility to not do harm to patients. Instead, systems thinking makes clear that human error is inevitable and that we should focus on creating systematic approaches that help catch human errors before they occur. Errors or failures are categorized as active or latent. Active failures refer to unsafe acts committed by frontline staff at the point of care, whereas latent failures are due to underlying weaknesses in systems or processes that may be caused by poor design, poor systems, or poor leadership. The most common strategies to address failures is to introduce training and policy change for active failures and thoroughly look at the system of interest, implementing evidence-based team coordination strategies, and changing the organizational culture for latent failures. One method of systematically identifying ways to reduce the risk of active and latent failures is to adopt a human factors engineering approach. Human factors engineering is the science of using tools and methods to understand human behavior, including human capabilities and limitations, to better design systems. Human factors engineering breaks down the layers of a system and its interconnected components to determine how to improve the design of a system that supports human strengths and compensates for human limitations. So how do we design systems that prioritize patient safety? Systems that adopt a human factors engineering and a systems thinking approach are high reliability organizations. High reliability organizations are organizations that operate in complex, high hazard domains without serious accidents or catastrophic failures over time. There are several key indicators that a healthcare system is highly reliable. To be highly reliable, healthcare systems must identify potential problems, detect issues early, and respond early enough to prevent catastrophic consequences. If failures do occur, high reliability systems focus on them. Even small failures indicate a deviation from high reliability that can snowball into tragedy. High reliability systems are also reluctant to simplify or explain away issues. Instead, they conduct an analysis of the cause of the error and reject simple diagnoses. High reliability organizations are not immune to adverse events. Rather, they are equipped with tools to convert occasional setbacks into an adaptive and resilient system. In summary, the healthcare system has made great strides in improving patient safety over the past 20 years. This improvement can be attributed to many factors, including analyzing factors that impact human behavior in the workplace by implementing human factors analysis and determining the system's role in human error. Practices such as human factors engineering and systems thinking have encouraged the development of high reliability organizations that effectively respond when errors occur and reduce the risk of catastrophic consequences. While improvements are evident, healthcare systems must continue to prioritize patient safety by adopting strategies to identify and mitigate the risk of adverse events in patient care.